Hey guys. We'll just wait a little bit. Hopefully we get more than 3 people. So today you get assigned your new project. So dibs goes to the people that are actually here, so that's good. And so just a couple of things that are going on here, just to remind you, your joints review assignment is due today, was due 45 minutes ago. So if you haven't got that in yet, make sure you get it in. You will have a quiz on Monday on muscles and joints. On Wednesday, your project is due. So you guys will pick the topics for your projects today. So I'll go through that with you. And then on Friday, I'll open up your final exam for this section. Okay, so that's what's going on with this. So today we're going to talk about conditions associated with muscles and joints, which will take us not very long. And then we'll go through the project. We'll end probably around 15 to 20 minutes earlier than normal. And then that'll give you that extra time to do some research. Okay. So that being said, let's start on with this. And I just need to get this on my Google Classroom because we will pick topics by random once again. Okay. So let me get this PowerPoint open for you guys here. Way too many things open right now. There we are. Okay, so we're just going to talk about some of the conditions that are associated with our musculoskeletal system. So we talked about the skeleton already. We talked about conditions associated with the skeleton. Now we're going to talk about conditions associated with either the joints or the muscle. Okay, so the first category, so when you look at the curriculum for this, it talks about there's different sort of categories of conditions associated with the musculoskeletal system, and in that category fits metabolic diseases. So when we're talking about joints, metabolic diseases, just gonna get a little spotlight going here. Metabolic diseases basically mean that we have too much of something in the joint, too much of a substance. So this one here is called gout. So gout is where we have a buildup of something called uric acid, and it hangs out in the joint in our toe. So your toe can start to swell up and be really sore, often caused by a poor diet. And then this is a different type. This is called pseudo-gout. So gout tends to be in the toe, but it can be in other joints. This one is not in the toe, and it's not uric acid crystals. It's a different kind of crystal called calcium pyrophosphate. And that can occur in other synovial joints in our body, okay, again, causing pain. Okay, genetic diseases. So I have a couple listed here. So muscular dystrophy is one that's inherited. So any genetic diseases mean that they're inherited from your parents, okay, so they're passed on to you through the genetics you receive from your parents. Doesn't necessarily mean that your parents had that condition, but it means it was on their genetics and you inherited it that way, okay? So spinal muscular atrophy, and there's several types of this condition. Basically what this is meaning is that the nerve that usually stimulates that muscle isn't working. And because that nerve's not working to stimulate the muscle starts to atrophy. So atrophy means to kind of break down, okay? It's not living, there's not as much of it anymore. So you might notice with people that you've seen who are paralyzed, maybe from the waist down, over time their legs usually start to look a little bit smaller, and that's because of atrophy of that muscle, okay? That's also a problem with people that are in space, is that because they don't get that daily pressure on their bodies, that their muscles can start to atrophy, right? And they have to exercise a lot while they're in space, and then exercise a lot when they get home to try to build that back up again. Okay, disorders of the joints. So joints damage often happens due to aging. So as you get older, and it can also happen because of an autoimmune disorder. So what does that mean? Auto is a prefix that means self. So an autoimmune disorder is a disorder where your immune system attacks itself. Okay, so instead of attacking an invader, it gets confused and attacks its own cells. Rheumatoid arthritis is an example of an autoimmune disorder where the immune system is actually attacking the synovial joints. Okay, and it makes the joints very swollen and difficult to move. So my mother-in-law has rheumatoid arthritis, as does her brother, as does I have an uncle on my dad's side that also has rheumatoid arthritis. Osteoarthritis is a condition where the cartilage starts to break down. So people can have this as an actual condition that they have, but this also tends to be a process that happens to people as they age. So as they age, the cartilage starts to break down. Well, that means when your bones rub together in the joint, instead of having that nice cartilage that allows them to glide against one another, you have all this friction and pain as the bones are actually rubbing right against each other. Another joint disorder is with a herniated disc. So this is looking at the cartilage between the intervertebral discs. So the intervertebral discs, remember, are the discs that are between the vertebrae in your vertebral column. And what happens is these guys here, oh, I'm not actually showing you a full screen, am I? I just realized that. Yeesh. 1 second here. Let's do a full screen so we can see better. So what happens is as this disc, it gets compressed, or it pushes, and the stuff that's inside of it starts to push out. And it pushes out and it pushes against the spinal nerve and it causes a lot of pain in the back. Okay. All right, spasms. So we've all had some kind of muscle spasm. So a spasm is where one muscle or group of muscles starts to contract, usually forcibly, not because we want it to, but just because it does, and it doesn't relax. A muscle cramp happens when that just keeps on. It doesn't stop. It goes on and on and on and can be quite painful. So our leg muscles are most prone to cramping. So like our quadriceps, our hamstrings, and our gastrocnemius, our calf muscle. And I remember when I was pregnant with my first child, at night I'd be sleeping and all of a sudden I would have this incredible cramp in my calf. And the only thing that seemed to help that is if I pulled my toes back towards my body and just quickly stretching the gastrocnemius took that pain away really quickly. So why do we get cramping? It can happen because we're dehydrated. It can happen because we've overused a muscle. It can happen because we don't have enough electrolytes feeding those cells in the muscles. There's lots of reasons why we can have it. Now, usually when we talk about these cramping, we talk about a Charlie horse. So Charlie horse is a term that's often used to describe cramping in your quadriceps, although it can be used to describe cramping in any of your skeletal muscles. Now, we can also have spasms in our smooth muscle. So remember, our smooth muscle is the muscle that we don't have any control over ever. And what can happen is it will contract. So remember, the smooth muscles in our blood vessels, in our digestive tract, in the walls of organs, right? So when they try to contract, well, what's inside there is air or liquid, and it really doesn't contract to pull all the way in. And that ends up causing a lot of pain. So when that happens in our intestinal wall, that's often called colic. So you might have heard your parents talk about babies being colicky. So usually what that means is they're in pain, so they cry all the time, but they're crying because of that contraction in their intestinal wall. And then that makes it so they don't sleep, and then the parents don't sleep, and it's a challenging situation. All right. Infections can happen. So an infection can happen causing damage to the joint. So infections can include infection by bacteria or virus or fungus. And what happens is it makes its way into the joint. Okay, so this is a form of arthritis called septic arthritis. So that's where we get an infection in a joint. Okay, injuries. So we can sustain different injuries. So strain. A strain we've talked about, so that's an overstretch or a tear in a muscle or a tendon. So when we talked about Achilles tendons getting a tear in them, that would be a strain in the Achilles tendon, okay? A sprain is a tear or rupture of ligaments. So when we sprain our ankle, okay, so we talk about rolling our ankle, that's a sprain. So if we look at the ligaments here, we see that these ligaments in this picture are torn. So they have to be stabilized in order to allow those to repair themselves, okay? A dislocation means that the two bones that are normally held together at the joint move out of place. They move out of position, okay? So if we look here, one of the most common dislocations is in the shoulder. So we have the humerus joined nicely to the scapula here, okay? And now the humerus has moved away from the scapula, so it's pulled away, so now they're not lined up properly. Dislocations can be really painful because even though we're looking at this picture, the bones moving apart, we have to imagine there's muscle there, there's tendons there, and there's ligaments there. So when that bone moves out of position, all of those different things are also stretching, causing a lot of pain. And the fix for dislocation is actually to put it back into place. So we can get dislocated, like I said, shoulders most often, but we can have dislocated elbows, dislocated hips, that kind of stuff, okay? All right, other injuries, bursitis. So bursitis tends to be an overuse injury. So remember talking about the bursa. So those are those little sacs that are filled with synovial fluid that help prevent the tension when tissue's rubbing next to the muscle. So bursitis is a swelling here, inflammation of the bursa. So that means that every time you move, so that's my elbow, every time I move my elbow, it's going to be really painful because it's going to put pressure on that bursa, okay? Tendinitis is when we have inflammation of a tendon. So in this image here, we're seeing an inflammation of the Achilles tendon. So that's not a tear, so that's not the same thing as a strain, but it's going to cause a lot every time I'm going to move my foot and I'm going to try to stretch that tendon, it's going to be really painful to me. So what I have here is common sports injuries. So we're going to watch a little video, just to 5 common sports injuries that can happen. So let me just share that with you here, guys. All right, make that a little bit bigger. And,
Runner's knee. Runner's knee is a condition characterized by pain behind or around the kneecap. It is caused by overuse, muscle imbalance, and inadequate stretching. Symptoms include pain under or around the kneecap, pain when walking, sprained ankle,
1-0 here in the 37th minute. She is between 2 Guatemalan defenders and then goes down and stays down, and you will see why.
The ligaments of the ankle holds the ankle bones and joint in position. They protect the ankle from abnormal movements such as twisting, turning, and rolling of the foot. A sprained ankle happens when the foot twists, rolls, or turns beyond its normal motions. If the force is too strong, the ligaments can tear. Symptoms include pain and difficulty moving the ankle, swelling around the ankle, and bruising.
And showing
Meniscus
how much
tear.
pain he in, and I think some of it was just being scared. But this guy, he doesn't like he want to go after Patrick. And
Each of your knees has 2 menisci C-shaped pieces of cartilage that act like a cushion between your shin bone and your thigh bone. A meniscus tear happens when you forcibly twist or rotate your knee, especially when putting the pressure of your full weight on it, leading to a torn meniscus. Symptoms include stiffness and swelling, pain in your knee, catching or locking of your knee.
But an MRI
Rotator cuff tear.
He has a torn rotator cuff. Kobe traveling to Los Angeles today to be examined by team doctors on.
The rotator cuff attaches the humerus to the shoulder blade and helps to lift and rotate your arm. A rotator cuff tear is caused by a fall onto your arm or if you lift a heavy object too fast. The tendon can partially or completely tear off of the humerus head. Symptoms include pain when lifting and lowering your arm, weakness when lifting or rotating your arm, pain when lying on the affected shoulder. ACL tear.
Here's Rosario on the break now, and watch Nerlens go up with a left hand, block the shot, and then on landing, there came the
ACL runs diagonally in the middle of the knee and provides stability. Anterior cruciate ligament tear occurs when your foot is firmly planted on the ground and a sudden force hits your knee while your leg is straight or slightly bent. This can happen when you are changing direction rapidly, slowing down when running, or landing from a jump. The ligament completely tears into two pieces, making the knee unstable. Symptoms include severe pain and tenderness in knee, loss of full range of motion, swelling around the knee.
All right, so those are some of the injuries associated
Hey,
with...
for you chiros out
let's
there,
get this
PTs, the
guy.
mobilized, and anyone else wants to try this shit drunk.
Yeah, we'll just shut him off here. Get out of this. Okay, let's go back. Well, PowerPoint, we're done here. So I'm actually going to share with you. Is there any questions about the PowerPoint and the different types of conditions we talked about? Anything you want to put on the chat? Okay. All right, then we're going to talk about the musculoskeletal conditions research project. So this was sent to you guys about 10 minutes before class. You would have had access to this document. So this is due Wednesday. So let's just go through it here. So same format, same kind of thing, exactly, basically the same other than the disorders you're looking at that we're going to be doing research on. So the formats you can use: Google Slides, brochure, poster, video, newscast, whatever is easiest for you to submit, but remember it's got to come to me digitally, okay? We'll look at these conditions in a minute. So the project needs to include, you've got to identify the signs and symptoms of the musculoskeletal condition. So again, if you're seeing these in sciencey language, you've got to tell me what they mean in your own words, okay? At minimum, you need to include 4 signs or symptoms. The cause of the condition. So remember, a cause is why does it happen, and then what part of the bodies are affected by it, right? So a cause could be genetics, a cause could be injury because of whatever some of the descriptions they used in that video we just watched. But what structures are affected? Is it just the muscle? Is it just certain parts of the muscle? Is it just the skeletal muscle? Is it just bone? So what parts of the body are affected, but why does that happen as well? So you need to include both those parts. And again, this needs to be written in your own words. So you're not cutting and pasting off the internet. I'm not looking for 6 paragraphs. I'm looking for clear, concise language that gives me a decent explanation of the cause, okay? Identify and describe the procedures or techniques used to diagnose. So how do they determine that you have this? So identify simply means naming the procedure. Describe means what is it doing, right? How is this procedure being used in order to tell us the individual has this condition, okay? I'm not expecting you guys to be able to, write me a thesis on how an MRI works, if that's one of the diagnostic tools, but 1 or 2 sentences on what it's doing in order for them to diagnose the disease using that method, or disease, condition, whatever. Identify, describe the therapy or therapies used, okay? So therapy is treatment. So identify is the list, right? What treatments are used, and then the description. How is this helping, right? If it's physiotherapy, if you say physiotherapy, okay, you've identified physiotherapy, but what are they doing with it? Do they rotate the shoulder? Do they use the muscle stimulation? What are they doing, okay? Identify a body system other than the muscular skeletal system that's negatively affected by this condition. This isn't something that I'm expecting that you guys are going to Google, right? You're not going to really look this up. You need to think about this. So we talked in our first course, the Health Services and Foundations, we talked about 11 different body systems, okay? Muscular and skeletal, we're including both of those in this unit that we're doing right now, right? So that means there's 9 other body systems that could be affected. So think about what's happening with the person. You're going to identify the body system, and then you're going to give me a clear description of how that body system is affected because of the musculoskeletal system being damaged, okay? And then 4 relevant images. Okay, so just scroll down here. So again, it's out of 24. You need a proper reference list. So some of you you just gave me a list of URLs. So I took a mark off if you didn't put it in the proper format. If you gave me nothing, I took 5 marks off, because you have to give credit where credit is due. So you have to tell me where this is coming from. And it's due on Wednesday. All right, so here we have our topics. And I'll just give you a heads up here. Spinal muscular atrophy actually has, I think, 3 or 4 different types. Just pick a type. So if you want to pick type 1, pick type 1 and then discuss that. You are not required to discuss all different types of that. Okay? All right. So I just have to look and see who is here today. So it looks like we have 9 of you. So I'm just going to write a quick list. So we have Ashley and Cork and Cassie, Cora, Haley, Jamin, Keegan, Owen, and Xander. Perfect. All right, so just make that small again. Just helps me so I can. So get your chat ready here, guys. And I'm just going to randomly, through my Google Classroom, pick people here. So okay, Corrick, you are number 1. Which one would you like to choose? So you just have to put it in chat for me, or you can unmute your mic and just say it, whatever's easiest. Okay, so Corrick has chosen bunions. That is what I have, and my dad has, and probably one of my kids will get. Okay, so that is Corrick. So get rid of that. Okay, next on my list here is Keegan.
I'll choose muscular dystrophy.
Okay, no worries, I'll write that down. Keegan, muscular dystrophy. And we'll cross that off our list here. Okay, next we have she's on my list. Ashley. Okay, Ashley has the sprain, so that's what Ashley's got. Sprain. Okay, next we have Cassie. Okay, and Cassie has chosen scoliosis. All right, so scoliosis goes to Cassie. Okay, and next we have Cora. And Cora has chosen shin splints. Okay, just cross that off our list. Okay, next we have Xander. Okay, and Xander has chosen rotator cuff. Okay, and there we are. Next we have Owen. Okay, and Owen has chosen cleft palate. Okay, and Jimin, you're next. Jimin has chosen gout. And Haley, last but not least, Go ahead and choose. And Haley's got osteogenesis imperfecta. Okay, any questions about my expectations on this? All right, so we're done about 20 minutes early, which gives you some time because you plan to be here 20 minutes longer. I would do some research now. It'd be cool if you could just get this over with before even worrying about the weekend. So that's it. The sun's sort of trying to shine behind those clouds, so get yourself some time outside, and we will see you guys on Monday. So don't forget you have that joints worksheet if you haven't had it that in, that's due today, and you have a quiz Monday that opens at noon. All right, so have yourselves a wonderful weekend, and we will talk to you guys on Monday.
I have a question.
Yeah, absolutely.
For muscular dystrophy, do I have to choose a certain type of it, or do I just do muscular dystrophy as itself?
If you see that there's more than one type, Keegan, go ahead and just pick one.
All right, cool.
Yeah, absolutely. No worries.